Hey everybody, welcome back to another episode of Doctors Go Live with me, Nina Sharul Khan, your host for Doctors Go Live, and today we are going to be talking about the warning signs of stroke. Now let us know if you are tuning in, where you are tuning in from, and how have you been, because we haven't seen you for a while. Chan, Fami, welcome. So nice to see everybody. Now, so do share with us how you have been, and of course, what would you like to learn in today's episode of the warning signs of stroke? Yeah. Yan, welcome. So nice to see you again. Now, if you share this video out as usual, you get to take part in our Doctors Go Live quiz happening right at the end of the Q&A, where you get to win today. It's non-woven bags filled with notebooks, pens, stress balls, and mugs. Okay, very handy. And all this happening right here on Doctors Go Live with me, Nina, and our special guest for today, Dr. Guek Tai Yan, consultant internal medicine physician and neurologist from Columbia Asia Hospital, Iskandar Puteri. Okay, now a stroke can happen to anyone at any time. But by learning the warning signs of a stroke, it can actually help you to take the necessary action quickly and maybe even save a life, including your own. Okay, so to better understand the warning signs of a stroke and what we can do, what we shouldn't do, we're going to look into all this and more, all happening right now on Doctors Go Live. So if you know somebody who this information will be super useful, or if you think that this is such an important topic that you want to share and it's going to make a difference to people out there, please do share this video out on your social media. Make sure you tag your friends, your family, follow us on social media, on our social pages, because this episode is definitely going to make a difference, in people's lives today. Can do. First, let's take a look at this video, all right?
Join us in the next episode of Doctors Go Live featuring Dr. Guek Tai Yan, consultant internal medicine physician and neurologist from Columbia Asia Hospital, Iskandar Puteri. Dr. Guek will be talking about the warning signs of stroke happening on Wednesday, 2nd March at 3 p.m. See you then.
Welcome back, ladies and gentlemen, to Doctors Go Live today, where we are talking about the warning signs of stroke. Now, during a stroke, every minute counts, as the video mentioned. By knowing the warning signs of a stroke, we can take quick action and maybe even save a life, including yours. So here to help us understand the warning signs of stroke, we've got you, our expert from Columbia Asia, Iskandar Puteri, consultant internal physician and neurologist with a special interest in stroke, Dr. Guek Tai Yan. Dr. Guek, thank you so much for joining us. Hi,
Hello,
welcome.
everyone. Hello, Nina.
Hey, thank you so much for joining us. I think this is such an important topic, right? Because we're seeing so many people tuning in. So yeah, if everyone can share, why is this such an important topic for everyone, and what would you like to learn from this? Dr. Guek will be here to help answer all your questions. Okay. Also, right at the end of the show, we've got a Doctors Go Live quiz where we've got some non-woven bags filled with notebooks, pens, stress balls, and mugs up for grabs. So you want to stay tuned because you want to take part in that. Okay. So if you have any questions, feel free to ask and we will address it right at the end. But first things first, let's have a chat with Dr. Guek. Dr. Guek, can you share with us a little bit about yourself? How did you get started in neurology with a special interest in stroke, and why stroke?
Oh, okay. Basically, I'm a neurologist, so I'm the one who give a talk on stroke. When I was a junior doctor, we frequently encountered people suffering from stroke. And very sadly, when 10 years back, or probably 15 years back, there's nothing much in Malaysia we can do for acute stroke. When people come with stroke, basically we just give some aspirin or some medication, but there's nothing much we can do to save the life or even to prevent the patient from having the neurological deficit, which means the patient probably will be bedbound for whole life, wheelchair bound for whole life. And it actually motivated me to become a neurologist with special interest in stroke, to treat these patients when they come, and hopefully they have a better outcome when they suffer from a stroke.
Wow, that's really amazing. Thank you for sharing with us. Since you have all this experience, you said 10 years ago there was not much options. Is it? Has it changed now?
Oh, this definitely. I think
In what way?
our fellow colleagues in Malaysia, in among the fellow neurologists, we have done a good job by promoting the acute stroke treatment in Malaysia. Now there are many centers in Malaysia which provide the hyperacute stroke treatment. I will introduce you, give you a brief introduction on the acute treatment available in Malaysia at this moment.
Okay, fantastic. So before we look into the warning signs of stroke, first things first, perhaps, Doc, can you share with us what exactly is a stroke? Because I thought it was related to a heart disease, or does it have nothing to do with it? Share with us, Doc.
Yep, sure. Yeah, I think in my slide, I will teach you really in a simple manner what is stroke, what are the signs, and what can we do about it.
Okay, shall we look at the slides now then, so that we can talk about the stroke? Yeah.
Okay, sure. So this is a slide. We're talking about the warning sign of stroke. Okay, this is our brain. Every one of us has a brain, and which we have the blood supply to the brain. What is a stroke? The stroke basically is a brain attack. But there are two types of stroke. The first type is the blood vessel in the brain. It bursts. For example, you have really high blood pressure. We're talking about blood pressure, or you're talking about blood pressure more than 200 something. The blood pressure is too high, and then blood vessel will burst, and it can cause neurological deficit. Another type of stroke, which we will emphasize more today, is a blockage. The blood vessel get blocked, and the symptoms of the stroke will be different according to which part of the blood supply is affected. Okay, so I will go through the warning sign of stroke now.
Okay, before that, I just have some questions.
Sure.
What causes the stroke? Because there's two different types of stroke. So what causes it? Is it stress, or is it how does one get a stroke?
Well, stress most of the time doesn't cause a stroke unless it causes really high blood pressure.
Okay.
There are two types of stroke, as I mentioned. One is the blood vessel rupture. It usually happens because the blood pressure is too high, way too high. So it causes the blood vessel to burst. And the blockage of the blood vessel happens when you have the diabetics, hypertension, high cholesterol, smoking, or when you have the abnormal heart rhythm. All of these can contribute to the blockage of the blood vessel in the brain.
I see. Okay, got it. So that's the one that we're going to focus on. Okay, got it. And is a stroke curable, or is it fatal?
Oh no, definitely it's curable. Most of the time it's curable.
Most of the time it's
like anything in life, there are sometimes we just can't do anything with if the patient come too late.
So it's important to bring them early and detect it early so that intervention can be done, right?
Yeah, right.
Yeah, okay. And how common is this, having a stroke in Malaysia? Because the data for US is 1 in 4, right? But for Malaysians, is it what's the epidemiology? I think that's the word, right?
US data is 1 in 4. There will be a lot. Maybe 25% of the US people had a stroke. I think it's a bit too high.
A bit too high. For Malaysians, what is it? Maybe my data is wrong, so ignore me. Because I get mine from Google. So, okay. So I better I trust you more. So what's the data for Malaysia?
According to the stroke survey which have been done in 2019, they estimate the number of the stroke patient is about 0.3% of the whole population. This 0.3% sounds a little, but if you times the number of the patients, the population per year, is quite a lot. It can come to more than 100,000 per year, right? I think easily we can have 100,000 per year.
And okay, so the number is quite a big deal. And why is it that knowing the warning signs of a stroke important? Because it's more common than we think? So educating ourselves can help someone, right? I guess.
Well, the reason we need to recognize the warning signs in every illnesses is because we can do something about it. If there's nothing we can do, there's no point you come early, isn't it? Even
Right,
though
okay.
you come early, you see a doctor, doctor will say, I have nothing to offer you. So when there are something can be done, then we need to know what is the warning sign. Just like you go for a health screening, you want to know whether you've got any cancer or anything like that. If you found you have cancer, there are treatment available. Of course, it's the best thing. Then you can cure from the cancer. But there's no treatment that then you don't need to know the warning sign. Basically, you need to know the warning signs because there are treatment available.
Okay, fantastic. So every minute counts, right? Kind of thing, because it can save life and we need to know. Okay, got it. So let's get straight into it. So what are some warning signs of a stroke then, Doc? What should we look out for?
Okay, so I think we look at the brain. Most commonly, the part of the brain affected during a stroke is this part of the region. So let's look at the area involved in this part of the brain, including arm. That's why commonly the people have stroke will have arm weakness. They will have involving the facial muscle, and this is why people frequently have the facial droops. I look at this picture. The right side of the face definitely is they are drooping. That's why you can't see the wrinkle there, the muscle, And I think many people will be curious. Sometimes whether I have the Bell's palsy, which is a viral infection of the seventh nerve, or I actually having a stroke. So the important point is look at the eyebrow. If the eyebrow is at the same level, most likely you are having a stroke. But let's say you look at the eyebrow, one eyebrow is higher than the other one, then most likely you are suffering from viral infection of the facial nerve, which we call Bell's palsy. Then you are not having a stroke. This is an important point to point towards whether you are suffering a stroke or a viral infection.
Okay, and is it always on the right side, the droop?
Oh, no. It could be on left side. Depends on which part of the brain affected.
Okay, just checking. Got it.
Right. And it can affect your speech. You can become blurry, or you cannot understand, or you cannot. The person cannot vocalize to formulate a sentence. Okay, I show you a video. This video is when I was in Singapore. I took part in the production of this video.
F. Face drooping on one side. A. Arm weakness. S. Speech difficulty. T. Time to call 995 for an ambulance.
Okay, this is the video which shows you the important sign of the stroke. FAST is really commonly shown whenever you listen to any other talks, because this is the common sign when the people have a stroke. But forget about 995. This is not the way you need to do in Malaysia. I will tell you what to do when you have a stroke in Malaysia. So just bear with me for the presentation.
Okay, got it. So FAST. So F is
face, the facial drooping. And A is arm weakness. And S is speech difficulty.
Yes. And T is
time. It means you need
time.
to
Okay, got it.
call for help immediately.
Okay. Does it all happen, or does it all happen at the same time, or how?
No,
Usually.
It could be either one. It
could be either one, yeah. Because some people, I mean, like me, will be waiting. Okay, this one not yet happened, so then maybe not lah. I don't know,
Yeah. No.
So
it
can be either one, huh? Okay.
Because the brain is really big. You see I show you this brain is really big. So whether you have any what kind of symptom you have depends on which part of the brain affected. So let's say you have the small part of the brain only affecting the arm, you only have arm weakness. Let's say you had the part of the brain suffer from stroke is only involving the face, you only have the facial weakness. Same go for the speech, and I'm going to tell you other sign of stroke, because see, only this part of the brain is explained or given you warning, FAS, in most of the commercial. But in this talk, you're going to know there are actually more than that. There are more signs of stroke than you know from the common educational campaign, which include the balance. Okay, let me show you a video.
Yes, please. And thank you for sharing with us all this, Doc.
Yeah.
That's why you come to Columbia, Asia to listen, okay?
Okay, I'll try to load this video.
Jalan boleh. Jalan sini. Cuba ikut garisan. Okay. Cuba
Is it
loading a bit?
Oh, the network. Sorry for the network. So,
no worries.
Okay, basically this lady, she complained of the weakness or unsteadiness. When you examine the power is very strong. But as you can see clearly, she's not able to walk steadily. Initially, one of the doctors thought the patient actually is malingering. He thought she's a psychological patient, psychiatric patient. But we did the MRI, which shows a really small stroke, which caused the balance issue.
And she didn't have any of the FAS
she doesn't have
symptoms. Okay.
Yes, she doesn't have the FAS.
So this one went straight for the balance. Okay, very interesting.
She had a balancing issue.
Okay.
So then the next one you're going to look at that is the eye. Okay, have you ever imagined the stroke can affect your eyesight? Yes, of course it can. Let's say you look at a screen and you cannot see half of the screen is white out. You had a visual field cut. Actually, you have a stroke affecting the eye.
I see.
The eye means the brain processing the the eye image. So this is also actually a type of stroke. This type of stroke usually they come really late because they have no idea that actually they suffer from stroke. As a result, when patient come, unfortunately they may have suffered permanent visual loss as a result of this kind of stroke.
Oh, I see. Would they have had other symptoms, or it could just go straight to the vision blurry thing?
Yeah, if the stroke, the blood supply disruption is happening on the eye part, then they only have the visual field defect. They don't have other symptoms.
Okay.
But if the stroke involving larger area, then they may have other symptoms as well, like imbalance or depending on which part of the brain is affected.
Okay, got it.
Okay, so like I'll give you another one. Like this part of the brain is the function is calculations. I'm going to show you a video of the lady which lost the ability to count. Hopefully the loading of the video is better.
Okay, Auntie，你的手拿起来可以吗？左手 ，OK， 很好，脚拿起来可以吗？
You can see she can move all the limbs.
Auntie，你叫什么名？叫咩名？
運手力。
OK。3加5等於多少
I asked 3 plus 5.
加
3 plus 5.
加
7.
OK， 好 ，OK。你那个你写字吗
？So as you can see, this lady she was really good at mathematics before. When
I see. Okay.
Affect the calculation, I asked 3 plus 5. Her answer is 7. So basically, the stroke affecting the calculation of the brain.
I see. Okay. But if you're already bad in maths, then no difference lah.
Okay. Some people say, well, 5 times 7 times 3 times f whatever divided by 10 or sort of thing. I think usually you also cannot answer, then it's not considered.
Okay, got it. Yeah, because I was just having a session with someone who said, "Oh, I'm very bad with numbers," so immediately I was like, "Oh."
Yeah, you have to be reasonable with the education level of the patient. And the front part of the brain is more on thinking part. For example, 2 days ago, there is one elderly came to me. The family complained he talking nonsense. He's not talking sense, or his behavior changed. And we did a scan and then show the front part of the brain actually suffer from bleeding. So it doesn't have weakness, just affecting the part of thinking process.
I see. So is that why, like I was doing some research online, they were saying that some stroke patients, they talk gibberish, they're not clear, and then they also, is that true?
Can be, but it could be due to affecting the speech area as well.
And they talk gibberish, they said. It doesn't make sense. Some of them.
But most of the time, the kind of the stroke is affecting the speech area.
I see.
Like that guy is more of the memory part, more forgetful, all the higher mental function of the brain.
Yeah. Doc, Yu Kyung is also saying, I'm very bad in maths too. So he's saying, okay. So don't worry.
You want to come to have a brain scan? Okay. Anyway, it should be sudden. No, it should be sudden.
Okay. Yeah. If you're already very bad, you still bad. It's okay. Same. Right. You're okay. You're safe. Okay.
Okay.
Got it.
And I'm going to tell something more of the local culture things. You probably won't hear this if you listen to any other talks given by foreign speakers. In Malaysia culture, we are, especially Chinese, they like to prick the fingers during the stroke. They think this is a treatment for the stroke. And of course, this is not true. I would like to explain to you why it's not.
But it makes sense because they probably because they think there's a block. So if you prick that, you clear the block lah. I mean, I think lah. It's like a
It sounds logic, but let me show you the diagram.
But I would like to understand your answer. Yes.
Okay, so you see this is the diagram. We have the heart, which there will be blood supply to the brain and also every part of the body. In a case of a stroke, the blockage happens in the brain here. Okay, so when you actually prick the fingers, you bleed the blood from the fingers. It actually doesn't help at all. I'll give you an example. For example, it's like the drain in your master bedroom. Hopefully, the second floor or the first floor of the master bedroom has a blockage there of the piping, and then the plumber come. They say they want to break the pipe outside of the house. It doesn't make sense at all. It doesn't make sense at all. Same for our body. When you have a blood clot in the brain, when you prick the finger to release the blood, it doesn't help at all. It's really sad actually when we see a lot of patients, they already suffer from stroke. It's already really unlucky, really unfortunate. And we see all the fingers of them is being pricked. Sometimes even including the ear loops. It's really painful, no? If you know that to prick the finger is really painful. Acupuncture pricking the arm or whatever is not that painful. But our finger is extremely sensitive to prick. To prick the fingers when someone already suffered from a stroke is one of the bad things you should not do. You must remember this doesn't help and don't do it. What you need to do is to send to your nearest stroke hospital, which I will teach you how to localize them.
Okay, fantastic.
Okay.
Okay, so so basically no to pricking the finger. Got it. How common is this? Do a lot of people do it?
A lot of people, especially Chinese.
Okay, got it. The Malay didn't get the memo.
Yeah. Sometimes they even spread this message to other part. When they always say it's a traditional Chinese medicine method, so Western medicine doesn't really, or modern medicine doesn't really believe it. But when we communicate with our colleagues, experts in China, none of them are doing that as well.
Oh, wow.
So what we can say is mainly Singapore and Malaysia things. Singapore also, they also like to do it. So I think it's something we should try to eliminate from our culture because it definitely doesn't help.
Okay, fantastic.
Okay, so we can discuss a little bit how we're going to treat acute stroke. When you have a stroke, actually treatment is now available. Okay, now you try to imagine a pipe in your house has a blockage. How you try to get rid of this blockage? Okay, I think most of you will say, wow, there's a type of the liquid Which
Wow, you
can-
even put the Shopee thing there.
Yeah,
Fantastic. Okay.
It's a powder, it's some drain remover.
Okay.
Basically, you pour the solution inside, you will
Dissolve.
resolve all the blockage. Same for the blockage on the brain, but the name is of course different. We call it antiplates. Antiplates is the type of, there's other medication, but it is more common. The commonest usage, more commonly used in Malaysia. You give this medication into the blood, it can actually function as a clot buster. It can dissolve the blood clot in the brain and restore the blood flow to the brain. So the stroke, you mean it can restore the blood flow, then the part of the brain which suffer from stroke can recover immediately. I mean, the recovery of the stroke won't take months. And sometimes the stroke won't even recover if you have the permanent damage. And this condition can help a lot of patients.
Okay.
The benefit of this patient is at least 10 times more than the potential harm. And what I want to say is one thing is really important. Golden hours. Golden
what
hours
is this golden hour?
4.5 hours from the onset. I mean, from the time you have the stroke, within 4.5 hours, then you can be. We must give the treatment. But it doesn't mean that you must wait for 4 hours to go to hospital. If you have the stroke, you should go immediately, because the earliest you give the treatment, the better is the outcome.
For recovery, right?
Yes, for recovery.
Okay, fantastic.
Because the part of brain damage is less compared to you're waiting for a long time. During acute stroke, hyperacute stroke, every minute there are millions of the brain cells are being damaged. So you should go immediately. And if you fail to remove the clot by using the drain remover or whatever, then sometimes when you put a stent, some wire go inside and try to remove the blood clot, to remove the whatever dirt inside the brain. It's the same thing for the blood vessel. If you had a clot which is really big, we can actually use a stent, a wire, to go into the blood vessel and remove the blood clot.
Isn't this the same treatment for heart patients?
Yes. More or less the same.
Okay.
More or less
Because
the same.
it's blood clot as well, right?
Yeah. We're talking about a heart attack. Heart attack is the blood vessel to the blood supply to the heart is being blocked.
I see.
In a brain attack, is a stroke. It means the blood supply to the brain, the blood supply is get disturbed and blocked. So what we need to do is to restore the blood flow as soon as we can. So by putting a wire in to remove the blood clot, you actually can restore the blood flow immediately. For example, I want to show you one case. This is a gentleman. He has the weakness over the left side of the body.
And what could he not do with the left side of the body?
Yeah, you can't leave it out. Basically, you can't leave it out.
Okay.
He had a really big blockage over the right side of the brain.
So the injection or the solution didn't work lah.
In this case, he cannot have the injection of the medication.
Why not?
Because he's taking some blood thinner. The blood thinner is a contraindication for the treatment. So immediately we put the wire in to remove the blood clot.
Okay.
Okay, so believe in me, he can move left side.
Okay. So basically, you put the wire in to remove the clot.
No,
right?
it's not me. We're working really closely with the interventional radiologist.
I see.
So basically, we see a really big blood clot there. You see the really bright signal over this side. This is the right side of the brain. So our colleagues, interventional radiologists, go inside and take out the blood clot. Okay. And then from the imaging, this is the blockage part, And then after we put the wire, and we can restore the blood flow, which we call decanalization for medical terms. And these patients are basically doing really well with the treatments. Okay, you can see the video is loading, which you can't see, right? Can you see it, Lina? It's loading, is it? Lina, where you go? You leave me. Lina left already. No, I think must be some live problem. He will join us as you will join us in a short while. Okay, so this patient, now you can look at the picture. Just after 3 days, after suffering from a really big stroke, he's able to walk again. Just after 3 days. So this is the treatment that which you can give with the modern of medicine. The stroke is no longer a thing which we cannot do anything. He can walk quite well just after 3 days. In this kind of case, usually when he suffers this kind of stroke, the most likely he will be paralyzed the whole life. Okay, now this is the important message which you should take notes. There's one website which is called My Stroke Hospital. This is the hospital, the website which will tell you all the hospital in Malaysia which is stroke ready. What do you mean stroke ready? When you go to a hospital, it doesn't mean the hospital providing acute stroke care. So it's important before you make a move, you know that the golden period, the golden hours to treat a stroke is really short. It's less than 4.5 hours. So you don't want to waste time to go to another hospital and then they give the treatment and then only then they transfer you to another place, which is going to take a lot of times. So what you need to do as a patient or as a person with the knowledge, you will know that you should go to this website, My Stroke Hospital. You can localize yourself, and then the website will straight away tell you which hospital is nearest to you, and the hospital is stroke ready, so that you can receive the treatment of the stroke immediately without any wasting of time.
Okay, awesome. Doc, thank you for saving the day. My internet just got cut off because it's raining here, kind of thing. But thank you. So basically, that thing will sort of help people to prepare in advance, lah. Okay. But Doc, before we even get there, are there some? You mentioned that there are certain signs that you can tell because it's usually to do with some diseases that we might have, and so the probability of a blockage in the blood is higher, right?
Mm-hmm.
Yeah. So any advice on that?
Yeah,
how do we take care of ourselves? Yeah.
If you really want to know what is the warning sign of the stroke, if you ask me, I would say that number 1 is your high blood pressure. Number 2 is your diabetics. Number 3 is cholesterol. And number 4 is smoking. And number 6 and number 5 could be you potentially have abnormal heart rhythm. This is why it's important. I think if you are after a certain age group, I mean, when your age catching up, it's important to have some health screening to make sure you don't have the diabetics, hypertension, or high cholesterol, or abnormal heart rhythm, which I mean is atrial fibrillations. And of course, if you are a smoker, I will advise you to stop smoking because it's definitely associated with blockage of the blood vessel in your heart or in your brain. Yep.
Okay. And this is for the second type of
a stroke. Yeah. Yeah. The first type is the hemorrhage, right? The bleeding in the brain. The bleeding in the brain is very much related to the high blood pressure. So make sure your blood pressure is well controlled. Then the chance of you to have the burst vessel in the brain is very much less. Hello, Nina. How are you?
Okay, I'm here. Okay, so that was for that particular type of what do you call that? Stroke, right? What about the other one, the high blood pressure one? The one where it bursts. Is that to do with high blood pressure?
Yeah. Just to make sure the blood pressure is well controlled. Yeah.
That means cannot stress lah, is it?
Yeah, when you stress, the blood pressure will go up. So
Okay.
better to take care of your stress.
So stay away from people who make your blood pressure go up. That's what I would say.
Yeah.
That's what our parents would say, right? Okay. In your experience, how do we support a loved one who has had a stroke, or who has the potential to get a stroke, like what you said, those warning signs?
Yeah, when someone got a stroke, especially our loved one, there are three things you need to remember. You need to tell them so that they will remember.
Mm-hmm.
Number one is you need to ask them, you have to be careful. Because when you have a stroke, big or small, you don't want to fall down, you don't want to hurt yourself, fracture the bone, or have the bleed as a result of the fall. It will complicate the recovery process of the stroke. So number one, make sure, be careful. Ask them to be careful. Make sure when they try to learn how to walk again, it's always under the supervisions or under proper training. So number one, be careful. Number two, you need to tell them, be patient. Be patient. Because stroke recovery, it doesn't happen in 1-2 days, not even 1-2 days, 1 week, 2 weeks. It usually happens over months. Okay, so you need to tell them the recovery process. Look at it from week to week, rather than from day to day. Like they say, you said this week you're better than the last week. This month you're better than the last month. So they have to be patient, because if you have the unrealistic expectation to the stroke recovery, it's quite common for the patient to get depression or anxiety as a result of that. And number three, they need to remember to focus on the rehabilitation process.
Mm-hmm.
Because stroke can cause weakness, it can cause deficit. First is as a result of the brain damage, and another is because the patient did not exercise enough. For example, when your arm, you don't use it for a long time, you become weaker and weaker. It's especially true when you're suffering from a stroke. So
then, Doc, for us, the past 2 years, finish lah. All stay indoor, don't go out. And then eat some more, right? Worse during the pandemic.
Yeah, it's correct.
Right? Okay. Fantastic.
So they had to focus on the rehab and to improve the power, and at the same time make sure the range of motion of the joint is well maintained. Because our joint is just like the hinge on the door. If you don't move it, you will karat. You can't move it. Even though you have the power, you won't be able to move it because the joint have been stiff. So that is really important after the stroke. Besides exercising to improve the power, they must always exercise to make sure the joint movement is maintained in good range of motion.
Okay. Got it. Fantastic. I think this was really important for us to know. And one last question before I go to the Q&A. What do you think, in your experience, what's the most common mistakes that people make when it comes to dealing with stroke?
The most common mistake when someone had a stroke? Is it true?
Yeah. When it comes to dealing with stroke, that you see from your experience.
Yeah, I think the most common mistake is people don't think stroke is an emergency. When the reason is people when the people have a stroke, they always come really late. The reason is, and it's really contrary to the heart attack. The reason is heart attack is really painful.
Okay.
When you have a heart attack, you feel you're going to die, chest pain. So you go and see a doctor immediately. The problem with a stroke is it doesn't really cause much pain. It just causes you cannot move or cannot talk. So most of people, when they have this kind of scenario, they will you will just think less sleep or let's take a nap. Hopefully, you will recover by itself, which is a really big mistake. I think this is the number one mistake, which we all, I think all of us, our colleagues in other hospitals as well, they are always giving the talk to the audience, to the publics. The hope of like today, I'm giving this talk. You also to educate the people, know that this is not the right thing to do. When you have a stroke, log on to this website, My Stroke Hospital. Go to the nearest hospital. There will be a lot of the treatment can be done.
Okay. Fantastic.
Yeah.
Got it. I think that's really, really important. In some of the cases, just to share how important this is, how long do these people take before they come and see you or come for treatment?
Sorry, I can't hear you.
Okay.
The
In
line is
some
really
of
bad.
these, okay, in some of these cases, how long do people take before they come and see you or to get treatment that you've seen because they don't take it seriously?
Nina, the
Can
line
hear.
is really bad. I can't hear you. No. It's
Okay.
really blurring. Whatever
Okay, can you hear me now?
Okay, now probably better. You can try again.
Okay, cool. In the cases that you've seen, how long do people wait before they actually come and get treatment? The longest you've seen because they don't take it seriously.
Or do you mean how long the patient wait before they come to see me?
Yeah. Yes.
Oh, okay. I think average is few days, but sometimes we even see cases up to week.
Wow. And by then, too late already, lah, huh?
Yeah. Only a few, not many. They will come early. I think.
Okay. Okay. So let's go straight into the Q&A. First question is from Yu Kyung. Are strokes hereditary? Good question, actually.
Well, this is like there's a story. When a guy, who is really obese, and tell the doctors, this obese thing, is running in our family. And then the doctor said, well, it's because nobody run in your family. so the stroke hereditary, most of the time, they are not hereditary. Most of the time, the stroke become hereditary is because of the lifestyle we are having. But it cannot be denied when you are having a diabetes, your parents have diabetics, hypertension, and high cholesterol, the chance that you are having the diabetics, hypertension, or cholesterol, it will be higher. That's why we will advise if you have family history of any heart attack or brain attack, make sure you have the health screening earlier. It means at the age of 40, I think you should definitely consider to have the blood check and the blood pressure check. Make sure you don't have all these factors, and definitely you should not smoke.
Okay, love it. Brilliant answer. Speaking of the obesity, Arnib Kamarudin is asking, kurus atau gemuk berpotensi diserang stroke? Untuk diserang stroke?
Yeah, in general, gemuk had a higher potential.
Yeah, because of the heart and diabetes, right?
What does it indicate? Most likely indicate not healthy lifestyle and the unhealthy diet and lack of exercise. Because we know that it is the risk for you to get stroke or heart attack. However, it's a wrong concept to think that if you are thin, your cholesterol will be normal. A lot of people, I got friends, we are close friends. She's a lady. She's very thin. She always do exercise. She do her blood test and found the cholesterol is higher than mine. She very, said, why my cholesterol is higher than you? You're fatter than me. I said, this is the wrong concept. You are thin doesn't mean your cholesterol level is lower. This is a wrong concept.
Okay, fantastic. So basically, if you're, chubby, bigger size, there is a higher potential, but doesn't mean that if you're skinny, you're not going to get it. So best to go and get yourself tested and checked. Right, Doc?
Yeah, right.
Okay. And Yu Kyung is asking, can stroke patients recover fully?
Well, like every illness in the world, like any illness in the world, there will be a range of the severity. For example, we now everyone know COVID. COVID could be asymptomatic or could be so serious until you need to put a tube in to help you to breathe. Same for the stroke. Stroke could be a really small one. The recovery could be 100% even without any treatment, or it could be so serious until the treatment, whatever you give, may not be helpful at all. So the good news is most of the patients, they have really good recovery from the stroke. Most of the patients have really good recovery of the stroke.
Okay, fantastic. So there is a much higher chances now, right, of fully recovery compared to when you first started, right? That's the good news. This is also the question from Fami. And Kamala's question is, I think you answer it, do we in Malaysia have specific hospital care center for stroke patients?
Yeah, it depends. I think this question had two parts. The first part is acute stroke. The acute stroke is what I show in my slide. Yes, My Stroke Hospital. Try to log on to this website if you have a stroke. You have a stroke, make sure, or anyone has acute stroke, log on to this website, put in your location. This app will show you the nearest hospital, provide the acute stroke treatment. And then after the acute stroke care, we can do the next part is to prevent the stroke from happening again. That is the part we need to understand the mechanism of stroke. Why the stroke happens is because of diabetes, hypertension, abnormal heart rhythm, or whatever reasons. Then we need to treat accordingly to reverse the risk factor. And if your stroke already happens, the treatment already given, the next part is the rehabilitation. Rehabilitation, you can go to your hospital, your physician. Usually they will know the nearby hospital or nearby rehabilitation center, which can give you the best rehab care. In Malaysia, we have the one society called NASAM, NASAM, National Stroke Association Malaysia. There's an NGO, it's non-profit. They will try to help the stroke patient to recover to as best as they can for those patients with financial difficulty. There are other more commercial center, which of course the cost will be higher.
I see. Okay. I think all that is really good information. I think following Kamala's question, she's got one more. Rehab for stroke patient, where do I go? I think you just mentioned it, right? It's the same?
Yeah.
Okay. And also Fakri's follow-up question is, can stroke patients recover fully? If yes, how long does it take? I know you answered it before, but for those of you who just tuned in, Doc, could you share with us again, how long does it take?
Yeah, of course, stroke patient can recover fully. Depends on severity, depends on the size of the stroke. The smaller the size of stroke, the chance of recovery is better. But also important is location of the stroke. If the location of stroke happen in the very important part of the brain, sometimes the recovery may not be so good as well. Most of the time,
some examples, Doc?
Well, it's a bit difficult because you need to know the brain structure.
Okay.
Some part of the brain structure, for example, brainstem, it's just like the highway of the brain, which all the important structure is localized there. Let's say the stroke happening there, big one, then the chance of recovery may not be so good.
I see. Okay.
Or you involve a really big vessel, again the recovery will not be so good. But most of the time, luckily, most of the time you won't be so big. Hopefully the stroke, whatever stroke you suffer, whoever suffers now is a small one. Then almost certain that the recovery is almost 100%. And recovery process usually take months.
Okay.
To be conservative, we always put 3 to 6 months as the time required for the recovery to take place.
3 to 6 months is actually pretty good, Doc, because I was thinking it could be years of rehab and stuff like that.
Yeah, if you talk about the most of the deficit, depends on which type of deficit. 3 to 6 months is the standard answer we give.
I see.
But there are some type of the stroke. For example, affect the coordination of the movement, like balancing.
Mm-hmm.
Because the power of the patient is still good, I mean the patients actually stand a chance to further improve even after 6 months. For example,
Okay.
it's just like your writing is not good
Mm-hmm.
because of poor coordination. Just like small kids cannot write a really good handwriting. With further practicing, then the handwriting can improve. Same for the stroke. If the power is good, the patient only had difficulty in coordination of the movement, then this kind of stroke, it can further improve even after 6 months.
I see. Okay, fantastic. One last question before we go into quiz. Yu Kyung's question is, remember you said that you have, how many hours was it? Was it 2.5 hours or 4.5 hours to bring a stroke patient in to respond within?
The answer is earliest as we can, but to give the treatment to give the medication, to dissolve the blood clot is 4.5 hours.
4.5 hours.
But
Okay,
of course,
fantastic.
you can't expect, if you reach the hospital by 4.5 hours, there's no way the doctor will be able to run the investigation.
Yeah.
So some center they will say, no, you must come within 3.5 hours or 3 hours for them to have enough time to go through all the scan, to run the blood test before they want to give the treatment.
Because by then 4.5 hours already, right?
Yeah, I think the most important thing is, remember, when you recognize the stroke, go immediately.
Okay.
And then there's a chance that the treatment can be done.
Okay, basically, even though doc said 4.5 hours, bring in as fast as you can, as soon as you see any symptoms, any warning signs, that is. Okay, so let's go straight into the Q&A. We've got some awesome stuff. Doc, don't go anywhere. You just sit there because we're going to have some more questions for you later. There's quite a few here. This is a very popular topic, I have to say. So in the meantime, how many of you guys want to win some awesome, amazing quiz stuff? It is up for grabs. Let me know in the comment section. So it is quiz time right now. And as mentioned earlier in the start of the show, we've got some non-woven bags filled with notebooks, pens, stress balls, and a mug up for grabs. So what do you need to do to win? First, you got to be sure to share this video out at least 3 times, and remember to set the share post to public so that everyone can see. Next, answer the 3 questions that will be shown on the screen in a single comment, and you're on the way to win the prizes. Okay, let me repeat that. First, share this video out 3 times and make sure you remember to set the post to public so everybody can see it. Secondly, answer the 3 questions we will show on the screen in a single comment, and we will select the first 3 winners based on speed, the correct answers, and the shared post. Got it? Are you guys ready? Ken? All right, let's go. So if you are ready, question number 1, face drooping, arm weakness, and speech difficulty are all signs of stroke. Is it true or false? Stroke is a brain attack. True or false? Stroke warning signs often occur hours and even days before an attack. Is it true or false? Let me repeat the question. Face drooping, arm weakness, and speech difficulty are all signs of stroke. True or false? Stroke is a brain attack. True or false? And stroke warning signs often occur hours and even days before an attack. Is it true or false? Remember, answer the question all in the same line. Make sure that this video, your post, is shared to public. Okay? Can do? Okay. While waiting, Crystal and Kavita, make sure all your answers are in a single line, like Chan Lee Hong, very good one, that one. Yeah, and SP Anwar. This one, all experts come and join us every week. So while waiting for the answers, let's go back to the Q&A. Yeah, Doc, you ready? Okay. Fami is asking, is there any treatment we can do for eye stroke?
Yeah, can, sure. The treatment is the same.
The treatment is the same.
Yeah, if we see it can come early, then we know the clot just happened within 4.5 hours. We can give the medication to dissolve the blood clot.
Okay, got it. So basically, it's the same treatment. Thank you very much. We thought specific or I1, you know. Rose Adila, what a beautiful name, is asking, is it possible to be attacked by stroke again after being cured?
Yeah, of course. Because the first time you get a stroke, then we need to know what are the risk factor you have to cause you to have the stroke. Actually, it's not uncommon actually. For example, I know sometimes we have the patient, they come to me with second stroke or third stroke. Then you look at the reasons, and we found that actually got abnormal. It could be due to the stroke mechanism was not given the proper medication to prevent it. For example, when you have the abnormal heart rhythm, the treatment is not aspirin. The treatment of the medication is another type of medication, which to make your blood thinner. Or if you have a stroke and you recover from the stroke, and then you continue smoking, you continue let your blood pressure very high, you continue have a very high cholesterol or really uncontrolled diabetics, yeah, true enough, I'll tell you most likely you are going to have another stroke.
Okay, so basically, it's those are warning signs that something's not right in your body. So you gotta do. It's an intervention to do something about it, and you want to work with your doctors to find out what the cause of it is, and intervene and make different choices, healthy choices. Yeah. Yep. Okay. So Karen's question is: if I had stroke before, should I be taking aspirin or prescription medication to help prevent another stroke?
Well, if you have a stroke, it's the stroke due to the blockage, and most of the time we give aspirin. And the minimum medication you need to take are two medication, which is aspirin or other type of antiplatelet, or and a cholesterol medicine. Because cholesterol medications not only lower down the cholesterol, it can also make sure your blood vessel, the plaque, is stabilized. So when you have a stroke, there are two medications. Most likely you need to take lifelong, which is antiplatelet, which include aspirin, or and a cholesterol medications, which can help to stabilize the plaque. And of course, if you have other risk factors like hypertension, diabetics, then you need to take more pills to reverse the risk factor.
Okay, but again, she definitely. So basically, listen to what your doctor prescribes, right? Yeah. So basically, yes. Okay, cool. And SP Yan is asking, hey, SP Yan, welcome. Dr. Guek, my auntie is down for stroke. She can't count, I assume cannot speak and recognize color, but she can play cards and mahjong. Why does this happen? Yeah.
Need a proper assessment. She can't count, she can't speak, and cannot recognize color, but she can play cards and mahjong. Well, mahjong you have a shape, right? Mahjong you don't need to count. Actually, I think what your auntie do is he following the pattern of the picture. Mahjong is basically you need to follow the pattern of the picture. Probably he following the pattern rather than doing the calculation.
I see.
Need to further assess to know where is the deficit.
Okay, got it. So best is to get the doctors to look into it and try and understand. Okay, got it. So Nurul is asking, if someone gets a stroke and effect on the face, how to overcome it before she go to hospital?
Someone got a stroke and effect on the face, how to overcome before he or she go to hospital? Never mind, just come to hospital.
Yeah, I love your answer. Thank you very much. I'm not quite sure whether.
Hospital.
Okay, I think it's important that you go straight to the hospital. No need to overcome. Overcome takes time. You only have 4.5 hours. Okay. Itu also if the hospital not jam with other people. Okay, we have already answered this, and Espian is also asking, if someone is down for stroke one morning, her whole body is cramped, is it a warning sign that she has stroke for a second time? If the whole body is cramped?
Likely not. Because
what could that be?
When you have a stroke, if you can imagine someone has a stroke, the way they walk, they usually have this kind of posture, right? So the response of the body towards the stroke, they will have the spasm. So this is what we call tone. So when you are sleeping, you are really lembek. It is called low tone. After suffer from a stroke, your body will have a high muscle tone. So as a result, your body will tend to have cramp. You can talk to your doctor. Most of the time, they have some medication which can reduce the cramp. In a serious condition, sometimes they even inject Botox to reduce the muscle cramp. Yeah.
I see. Okay. That's very interesting to know. Thank you very much. Fakri's question is, Dr. Guek and Nina, can stroke patients fully... Oh, sorry, this one we already did just now. Rose is asking, is suddenly a person talking gibberish an indicator of stroke?
Lightly.
Lightly,
I
okay.
think it should be to be proven until otherwise.
Okay, so better come and...
Suddenly a speech disturbance is a stroke until proven otherwise.
Okay, got it. So better come to the hospital and check it out ASAP. Hypertension is a higher risk of getting stroke?
Yeah, sure.
Okay, definitely. So definitely you want to have a chat with your doctor and look into it. So because there are ways that you can prevent, right?
Yep.
Okay, and we've got our winners. Okay, so our winners are... Okay, but first, before we go into the winners, let's see what is the correct answer. Yeah, for the quiz. Okay, so let's take a look. So face drooping, arm weakness, and speech difficulty are all signs of stroke. The answer is true, right, Doc?
Yeah, right.
Okay. Stroke is the same as a brain attack, and the answer is also
true. Yeah.
Okay, and the last one is stroke is warning signs often occur hours and even days before an attack, and is actually false. Why, Doc? Can you help share with us?
Because most of the time we don't really have the signal for a stroke is coming. It can only happen in very few cases in which the blood supply to the brain is critically narrow. That means there are sometimes there is blood, sometimes there is no blood. Your body may get a signal and it may cause you to have a symptom which the part of the brain had reduced blood supply. But to say that often, no, that is not. Yeah, most of the time, the patient have a stroke almost just immediately before the patient having the stroke. I mean, it's not hours or even days.
So you might as well just go straight to the hospital. Okay, don't take your chances. That's what I'm learning today, kind of thing. All right, so let's find out who our winners are. Actually, there's quite a few of you who answered correctly, but you didn't share. So unfortunately, we can't select you as the winner. But the ones who did share and the fastest to reply and with all the correct answers, the winners of the quiz are Hani Sarah, number 1. 2, Fami Teja, and Yu Kyung. Congratulations to all our winners. Okay, woohoo. Okay, very good. They listen to you, Doc. Very good. So don't go anywhere, guys. What's going to happen is that we'll be contacting you right after the show within a day to get your details. So be sure to check your Facebook Messenger inbox. Okay, so congratulations to our winner. That is Hani Sarah, Fami Teja, and Yu Kyung. Okay, now thank you so much, Doc, for today. I've definitely learned a lot from you. But what about all of you tuning in at home? What was the biggest learning for you? Let us know in the comment section so we know that we did a good job today, and you're going to go home and save not just one, lots of lives after this, right? Yeah. So a lot of congratulatory message from everyone here. But what was your biggest learning today from our session with Dr. Guek today? What was the thing that you learned the most? And what are you going to take home, from now onwards? Kind of thing. Good sharing, Kamala is saying. And Fami is saying, terbaik, doctor, yo, kind of thing. All right, cool. Thank you so much, Doc. It was super useful for me and Yu Kyung as well. We must act fast. That's what I'm learning, because it's true what you say, every minute counts, yeah, kind of thing. And don't wait for 4.5 hours, the earlier the better. So that's all the time we have for today. We hope you learned a lot from today. Please give a big round of applause to Dr. Guek for all the amazing knowledge that he shared with us today. And if you know somebody who's going to really appreciate the tips, the info, the insights from today's show, please share this video out. Tag them because you never know who you're going to make a difference to and whose life it might just save. And please, while you're doing that, give us a lot of a lot of love while you're at it. Thank you so much. Till then, take care of yourselves and each other. And we'll see you guys in the next episode. Bye.